Okay, good morning, everybody. Good morning. Apologies, I'm getting organized. So we have a lot of little things to do today, which is great. Welcome to yet another exciting adventure of the council, which is pretty great. This will be our second to last meeting. We have one more meeting on December 20th before the end of the year. A lot of stuff to kind of handle today, both in terms of the agenda and even some off-agenda items. But just as a reminder, if you have cell phones or anything like that, you just put them in silent mode. You have to shut them off. We all love photos and selfies. But if you at least put them in silent mode, we do have the microphones, but we want to make sure that everyone can hear the commissioners and the testimony that comes up as we look at the contracts and the nominations. With that, I'm going to kick it over to Councillor Stevens for a reading of the poll.
Can everyone stand for the Pledge of Allegiance?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. I'd like to begin with a moment of silence for former Franklin Police Chief and security guard at New Hampshire Hospital, Bradley Haas. Thank you. At the recent candlelight vigil held in honor of Brad Haas, Susan Stearns, the Executive Director of NAMI New Hampshire, spoke to all in attendance. Her message was brilliant and impactful. I asked Susan to be here today in person to recite her remarks, yet she was needed in Washington, D.C. today. And to the entire law enforcement and first responder community who arrived so swiftly to secure the facility and keep folks safe. Media coverage about law enforcement is not always positive. At NAMI New Hampshire, we are acutely aware that what does not typically make the front page is how you sit with the broken. When we experience tragedy like a sudden death, or first responders are the first who comfort us, who walk with us. These moments rarely make the news, yet it is in these moments that we are reminded of why we call you heroes. And I would be remiss not to acknowledge the dedicated staff at New Hampshire Hospital who care for our loved ones with such compassion every day and continue to do so even in the midst of this terrible tragedy. You are always our heroes, offering us hope during some of the darkest days. We were deeply moved when you asked us to help coordinate a team of peer support specialists to support New Hampshire Hospital patients over the weekend. Thanks to our staff and our partners at the community mental health centers and peer support agencies, we held 6 peer visits on site following the tragic shooting. And virtually the same team returned Sunday afternoon. On Saturday, when one of our peers was asked if she was returning the next day, she said, "Yes, these are my people." So to our first responders, our state police who responded so quickly, and our dedicated staff, our leadership at New Hampshire Hospital, you stepped up like never before and put the needs of our patients first, and we're grateful. Thank you.
Thank you very much, we are going to kick things off today. Jordan has been here a couple times, Jordan Torobasaki, and he's come with a duo, which is great. So we'll introduce the Jordan, we call it Jordan TW duo. That's great. Gonna play a message for us.
So this is Matt Jensen on guitar. We're told that last time you got to hear our good friends Liz and Dan Fiella. And they apparently played a piece by our mutual mentor, the late David Surrett, who many of you probably knew. We're going to do a piece that was written by Matt here, and we're going to slide on into a couple of cheerful Irish reels just to make sure you're all awake before your meeting. You've got a website, yep, you can just search my name and the website will come up. Got a lot of good Christmas shows coming up.
Oh, great, Christmas show. Does that mean Christmas music?
In fact, it does.
Oh, okay. Great, great. Thank you. That was all right, that was fantastic. That was fantastic. So we do have a proclamation today, really recognizing Family Caregivers Month. As I mentioned a lot, we try to recognize folks and organizations and individuals that really go above and beyond in the state. The state is really managed at the community level. And we have folks that specifically around the family caregivers, our area agencies, that are always going above and beyond. They're always under constraints, whether it's financial or with people or whatever it is. They always find a way to help some of these services and make sure that they're getting out to the community. So we have a couple folks from, I think Karen is here from Community Crossroads and Nat from One Stop. And Karen right here? Great. Here, why don't you guys come on up and let's give them a hand. Great. So before I read the proclamation and everything, why don't you guys talk just a little bit about what's happening in the area agencies, what you do, and more importantly, how folks can get in touch in terms of access to certain services.
We all know I like to talk a lot. So area agencies support individuals around the state with developmental disabilities and acquired brain disorders, and we help them access the community by providing the funding that we get from the governor, from the state, and from the executive council to live independent lives out in the community. So it's a really great thing. I represent Region 8, which is 24 towns from Portsmouth.
And I'm representing Community Crossroads today, and I actually am a family caregiver myself and actually live in Region 1. So it's really what Matt was saying, you know, the area agency system is an integral part of supporting individuals with disabilities, with acquired brain disorders, and their families, or to them. And it's really, really essential.
And these folks that don't know, these are not effectively nonprofits, right? That are driven. A lot of the folks that are working at the area agencies, they're family members, they're folks that are kind of living on the front lines there. And I think that was at the heart of the idea behind it decades ago when it was formed. They really making sure it was community-centered as opposed to just one central location out of Concord. Have those community-centered opportunities, especially when you need to lean on somebody for the extra help that provides. So thank you guys very much for doing that. A proclamation recognizing Family Caregiver Month, November of 2023. Whereas the state of New Hampshire recognizes the informal caregiving by family members and friends that is essential for children and adults and older adults who have disabilities, fragile medical conditions, and behavioral or mental health conditions, and adults with Alzheimer's disease and related disorders to remain in the community. And whereas in New Hampshire, over 170,000 citizens provide informal care to one another, and nationally, nearly 1 in 4 households are involved in caregiving. And whereas nationally, 53 million caregivers make up our informal social service system, and 85% of long-term care is provided by unpaid family caregivers. Informal family caregivers provide the greatest share of long-term care for these individuals. And whereas among those counted as informal family caregivers, there's a growing number of grandparents who have taken on the responsibility of raising their grandchildren due to difficult parental circumstances, or parents being unavailable, with an estimated 2.7 million grandparent and kinship caregivers nationally. And whereas family caregivers also provide crucial supports to our nation's veterans by supporting their ability to stay in their homes and communities that they defended, surrounded by the loved ones that they fought for. And whereas while caregiving for a loved one is an important and rewarding role, it can also be difficult, as many informal caregivers are forced to miss days of work or even quit their jobs in order to care for their loved ones, adding intense stress to their households and often sacrificing their own health and finances. And whereas it's important to acknowledge and honor the love, dedication, and sacrifice of family members and informal caregivers across the state, now therefore I, Christopher T. Sununu, Governor of the state of New Hampshire, do hereby proclaim November 2023 as Family Caregiver Month in the state of New Hampshire and call this to the attention of all of its citizens. Thank you. Okay, we have a swearing in. We get to add a new member to our House of Representatives today. So is Paige, and I'm going to get it, I hope they get it right, Paige Beauchemin. Did I get it right? I was going to do Beauchemin for best friends. Paige, let's give her a round of applause. So Paige represents Hillsborough District 3, which is in Nashville. How are you? Nice to see you. Nice to see you. Good, good. Great. Good. Oh, yeah, there they are. I remember seeing you. How are you guys? Hey. Good morning. Good morning. Okay. Good morning. Good morning. Good morning. Hey. Good morning. Hey. Okay. How are you, buddy? Okay. Well, congratulations. You'll be elected.
Yeah.
Put it behind you.
Yes.
We're not worried about that for a couple of years.
Yeah.
Right?
You know how exhausting that is.
Oh, I find it. 400 years. That's great. Excited?
Yes.
Great.
Yes.
Great.
Sorry.
That's the charm of a good stirring. It's not a real stirring unless your kids are tugging on you. It's a family event.
Yes.
It's a family event.
Yes. Lifting your skirt in front of the whole room.
Okay, so I'm just going to
Call and response.
Call and response. There you go. Thank you for that. Of course, I'm not good with the word. Okay, so please raise your right hand. I state your name.
I, Paige Beauchemin,
Of.
Nashua,
You solemnly swear
do solemnly swear
that I will bear faith and true allegiance
that I will bear faith and true allegiance
to the United States of America
to the United States of America
and the state of New Hampshire,
and the state of New Hampshire,
and will support the Constitution thereof.
and will support the constitutions thereof.
So help me God.
So help me God.
I state your name.
I, Paige Beauchemin,
Do solemnly and sincerely
do solemnly and sincerely
swear and affirm
swear and affirm
that I will faithfully and impartially
that I will faithfully and impartially
discharge and perform
discharge and perform
all the duties incumbent upon me
all the duties incumbent upon me
as state representative,
as state representative,
according to the best of my ability,
according to the best of my abilities,
agreeably to the rules and regulations
agreeably to the rules and regulations
of this Constitution
of this
and
Constitution
the laws of the state of New Hampshire.
and the laws of the state of New Hampshire.
So help me God.
So help me God.
Congratulations.
Thank you so much. Wait, can we, oh. Wait, you guys.
Well, I'll be the next meeting. Right here. And we're going to go this way. Perfect.
Thank you. Thank you.
Congratulations.
Thank you so much.
Thank you. Okay. So when it comes to special elections, oh, we are. Is red on? Red is on. Oh, sorry. All right. So when it comes to special elections, we have more. Just wait, there's more. Oh, now we're on. Okay. Someone's having fun with the governor today. We have before us a precept regarding another special election to address. So a special election has been requested to be held to fill the vacancy in the representation of Stratford County State Representative District Number 11 in the City of Dover, Ward 4. Within the town, the City of Dover, Ward 4, and the towns of Lee and Mandarin. The filing period is set for December 4th, 2023 through December 8th, 2023. The primary election will take place on January 23rd, 2024, with the special election being held on March 12th, 2024. If only one person from each political party files, then there will not be a primary election, and instead the special election will take place on January 23rd, 2024. At this time, I ask for a motion to accept the precept for Stratford County, District 11, the city, including the City of Dover, Ward 4, and the towns of Lee and Medford.
Second.
So we have a motion and a second. All in favor of the motion, please signify by saying aye.
Aye.
Any opposed? With that, the precept is accepted. So moving forward, we'll officially call the meeting of the Governor and Executive Council to order. I'm going to begin by asking for a motion to approve the meeting minutes from our November 8th, 2023 meeting.
So moved. Second.
Any discussion on those minutes or changes to be made? Okay, hearing none, all in favor of those meeting minutes, please signify by saying aye.
Aye.
Any opposed? With that, the meeting minutes are accepted. Next, from the Office of the Secretary of State, we have our civil commissions. Could I please have a motion to confirm the list of civil commissions? So moved. We have a motion and a second. Any discussion or names to be added to that list? Councilor Kent.
For you, Governor. Christine Fowler, Rochester is notary. Lisa Noel of Tilton as a notary. Brian Clark of Rochester as a notary. Rachel Nurse, Rochester as a notary. And also I have Jennifer Ridley as a notary.
Okay. Quite a list. Any other names to place on the name of nominations for civil commissions? Okay, hearing none, all in favor of accepting the list with the additional names, please signify by saying aye.
Aye.
Any opposed? The list is accepted and approved. We have a couple resignations today. I'll begin by asking for a motion to accept the resignation of Joseph Griffin from the Board of Home Inspectors.
So moved.
Second.
Oh, Glassman, I apologize. We have a motion, second, any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, Joseph's resignation is accepted. From the Volunteer New Hampshire Board of Directors, could I get a motion to accept the resignation of Connor Jennings of Manchester?
So moved. Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, Connor's resignation is accepted. That concludes our resignations today. Moving on, we have some confirmations to accept. I'll begin by asking for a motion to confirm Tricia Thompson of Salisbury to the Adult Parole Board.
So moved. Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Tricia is confirmed. Could I have a motion to confirm Jody Bell of Manchester to the Board of Acupuncture Licensing? Acupuncture Licensing.
So moved. Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Jody is confirmed. Could I have a motion to confirm Linda Tartachek of Durham to the Board of Medicine?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Linda is confirmed. Could I have a motion to confirm Amber Epperson of Manchester to the Board of Licensure of Interpreters for the Deaf, Blind, and Hard of Hearing?
So moved.
Thank you. Any discussion on Amber? Council? Warrington?
Just to note that the documentation that we were provided was for the name Amber Jones. And this is Amber Epsilon. And I just wondered if we could clarify. This is the legal name she provided.
Epperson? Okay. So yeah, this was the legal name she provided, so I assume we looked at. Okay, thank you. Any further discussion? Okay, hearing none, all in favor, please signify by saying aye.
Aye.
Any opposed? And that Amber is confirmed. Could I have a motion to confirm Patricia Stewart to the Board of Licensure for the interpreters of the Deaf, Blind, and Hard of Hearing?
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Patricia is confirmed. Could I have a motion to confirm Hooven Fowler of Hampstead to the Board of Nursing?
So moved.
Any discussion on Hooven? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, Mr. Fowles is confirmed. Could I have a motion to confirm Heather Pearl of Loudon to the Board of Nursing?
So moved.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Heather's confirmed. Could I have a motion to confirm Dick Anagnos of Bedford to the Business Finance Authority Board of Directors?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? That Dick is confirmed. Could I have a motion to confirm Nicholas Curro of Londonderry to the Community College System of New Hampshire Board of Trustees?
So moved.
Any discussion? Nick? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, Mr. Curro is confirmed. Could I have a motion to confirm William Cass of Laconia as the Commissioner for the Department of Transportation?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? We suckered him in for another 4 years. And I have a motion to confirm Melanie Carver of Boston as the Deputy Director of the Division of Administration for the Department of Safety.
So moved.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? That nominee is confirmed. Could I have a motion to confirm Michael Kloss of Hopkinton as a Justice of the Land Use Review Docket for the Superior Court?
So moved. Second.
Any discussion? Yeah, Councilor Whitley.
Governor, I thought we had a very good hearing for this nominee, and after much discussion, I think he's a very good fit for this job, and he's going to do just great.
Oh, great. Good. Any further discussion? Okay, hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Michael is confirmed. Could I have a motion to confirm Eric Kaufman of Sudbury, Mass. to the Manufactured Housing Installation Standards Board?
So moved. Second.
Motion second. Any discussion? Yeah, Councilor Whitley.
Yes, Governor, I just wanted to disclose that I hold a license held by this board and will be voting.
Thank you. Any further discussion? Mr. Kaufman? Okay, hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, Eric is confirmed, and that concludes our confirmations for today. I do have some nominations to read into the record. As the Assistant Commissioner for the Department of Environmental Services, I nominate Adam Crapo of Concord. To the Board of Accountancy, I nominate Lisa Athanasia of Plymouth. To the Board of Dental Examiners, I nominate Mark Abel of Bedford. To the Compensation Appeals Board, I nominate Arthur Audrey of Somersworth. As the Director of Intergovernmental Affairs for the Department of Business and Economic Affairs, I nominate Jane Forrester of Meredith. To the Independent Investment Committee, I nominate Christine Clinton of Dublin. As a Justice of the New Hampshire Circuit Court, I nominate Jared Bedricks of Portsmouth and Benjamin Leduc of Bow. To the Manufactured Housing Installation Standards Board, I nominate Tom Blanchett of Loudon. To the New Hampshire Correctional Facilities for Women, to the New Hampshire Correctional Facilities for Women Warden, I nominate Sarah Preventure of Nashua. To the Sexual Misconduct Climate Surveys and Task Force within the Department of Education, I nominate Marcy Vaughn of Portchester. That concludes my nominations for today. So moving on, we have our consent calendar agenda. I'm going to begin by asking for a motion to accept the consent calendar.
So moved.
Any discussion or items to remove from the consent calendar for further discussion?
Just a point on item number 3A, is that it says in the notice and on the cover letter that this is the 171st annual report for fiscal year 2022. It is actually the 172nd annual report for fiscal year 2023. So to correct that, so that the minutes are correct.
Thank you very much. We got that in the minutes. Thank you. Councilor Kenny.
So I would like to remove for excuse me, 3A
Okay.
and 5A.
3A and 5A. Okay. Other items to remove from the consent calendar for further discussion? Okay. Hearing no more requests, I'll ask that the consent calendar is motion saying all in favor of accepting the consent calendar with the exception of items 3A and 5A, please signify by saying aye.
Aye.
Any opposed? With that, those items of the consent calendar are accepted. Could I get a motion to adopt consent calendar agenda item 3A?
So moved.
A motion and second. Discussion on item 3A. This is from the insurance department. Do we have somebody here from the insurance department? Okay. Yeah, let's see if we're here. I'm sorry?
Would you like to do 5A?
Yeah, let's do that. So if you don't mind, we'll track the folks from the insurance department down. I know it's pretty crowded back there. I don't know if they... Oh, no, please make it his way through. Great. Morning, Commissioner.
Morning, sorry for taking my private conversation outside.
Well, I do appreciate that. Council.
Morning.
Good morning. This is going to be an annual report, 3A, and so there seems there was some question about the financial examinations for the following domestic companies that were in progress, 7 of them. And I'm just wondering, is this been completed as far as this examination, or is it ongoing?
The bulk of them are ongoing. They take some time. It's a very intensive process when you're going in and looking at all of the component parts that make up a business's balance sheet, essentially, to ensure that they are in a strong financial position to be able to pay claims.
So with that, typically, you have an Anthem Health Plan, American Health, Matthew Foreign, in North America, that you have completed your examination. How long typically does it take?
The examination of that type can take anywhere between 8 months to a year.
Okay. So when we see in the reports, it's pretty much a given that we're going to see some that are completed at that point.
That's right.
Okay, that's all.
Thank you, Council.
Sorry. Thank you. The governor made a mess. Any further questions before? Any further questions? Oh, thank you. Right. I'm sorry. Bear with us. 30 seconds. Sorry. Yeah, these are not. I think we're just pushing it around.
I have this effect on people. I apologize.
Thank you. Sorry, Councilor Gaffney.
Thank you, Governor. I received your paperwork, which is volumes, but it really doesn't tell me. Now, Governor, I don't know if you've had an opportunity to read it or look at it, or the cover letter. This is when I asked about claims that people are saying are not being paid. It really, I mean, it doesn't, there are no specifics in it. There's just a bunch of something that people threw together so that you'd think that I might be appeased, but it didn't appease me.
I fully anticipated you'd have follow-up questions, Councilor Gasson. So,
Why did you address them?
So the slide deck that I provided you there was to be an education piece to understand how the claims process works and to identify those areas where the claim may not process as people expect it to. So that slide deck was more of a general presentation that the legislature had asked us to do, and so we did it. The memo was more in response to the dialogue that we had when I was here last. And I appreciate the fact, Councilor, that you were very concerned about the impact on the smaller providers of this issue that Anthem is working through. Unfortunately for the smaller providers, they don't have an entity that was able to survey all of the different providers in the state the way the Hospital Association was able to do for the hospitals. So the only data that we had was the aggregated data that our consumer division takes in, and see if we could make some sense of that to be able to project what the impact for the smaller providers might be. And it is the footnote on the 4th page that gets into that. So we received 115 complaints from those smaller providers. Of those, 25% of them were found to be a regulatory violation. So that is of a concern to me. That is a lot. And as I said to you before, I'm deeply concerned about the smaller providers. Not that I'm not concerned about the impact on the hospitals either, but most hospitals have the financial buffer to allow the process to work out. We're going to obviously be involved with that, whereas the smaller providers don't. So unfortunately, based off of the data that we had, that's the only information that I'm able to share with you as it pertains to the small providers.
So you don't have any answer?
Well, the answer that I can give you is that it is impacting smaller providers, and we're very concerned about it.
So how do you resolve it?
I'm limited in what I can legally tell you in terms of what we can do and are planning to do.
Okay.
Thank you.
Councilor Stevens.
Commissioner, can you break it down by specialty of these small providers, please?
I don't have it by specialty, no. I can certainly get that to you. I don't have that here in the report, but I can get that information to you.
My greatest concern, and we've had many discussions regarding it, is our small, almost boutique behavioral health care providers who are on the cusp of shuttering because they do not get paid. So I appreciate your help on this.
Very concerned about those providers as well, Councilor.
Thank you.
Councilor Gandy.
What's the average amount of time to take care of the claim within the city in adjudication?
Well, as I indicated in both the memo and in the slide deck, it is our expectation that a claim, assuming that the claim is clean, which is to say that all of the paperwork and the backup information is where it needs to be for that claim to process, that it will be processed between 1 and 30 days. After that, it's late. And then we need to figure out why.
Instead of giving me percentages, can you give me the number of claims? And I know it's not in here, you're not going to be able to give it to me today, but the number of claims that are wanted in 30 days and what that total.
I can absolutely get that number to you.
Simple, easy.
Yes, sir, will do.
Further discussion on 3A? Okay, all in favor of item 3A, please signify by saying aye.
Aye.
Any opposed? That item is approved.
You got an eye.
We got 6 votes on that one. Well, good morning, Ms. Drew.
Good morning,
Who
Governor.
have you brought with us today?
I have the Wilkins School Amherst students.
From Amherst, Councilor Wheeler. You love Amherst.
I love Amherst. Morning, students. How are you today? Are you having fun on your tour? Yeah. Are you learning a lot?
Yeah.
Okay. Well, I want you to learn one more thing, because in this south stairwell, there's a huge painting of a battle at Gettysburg called Pickett's Charge for the Civil War. That painting was in my grandfather's barn, and I used to play hide and seek. We used to run back and forth on it and all that stuff when I was your age. But now we got it hanging in the State House, and that painting hung in the Milford Town Hall for a while. It's the only wall we had was behind the stage of the Town Hall auditorium, and we had a really hard time finding a place to put it here because that's the only wall that would fit it in the whole State House. But anyways, take a look at that. Real live action, bullets, horses, flags. Some of the flags maybe in that battle were in the Hall of Flags down there. So enjoy your trip. Would you like to shake the governor's hand? Yeah. Come right down here. Single file.
Go this way, go this way. You guys are going this way.
Holy cow, pretty strong. Hey, guys, good to see you. Mr. said, there's a whole 50 kids that said they're never going to wash their hand again. And I thought, Dr. Chan is going to hear that all the way across Congress. All the messaging we did, please wash your hands. Okay, so we do have one more item on the consent calendar. Could I get a motion to adopt agenda item 5A on the consent calendar? So moved. Motion second. Any discussion on 5A? Councilor Ken? This is from our friends at Health and Human Services.
Good morning. How are you?
So this is a contract that involves childcare that we give to Center for Policy Research. And I guess it's a sole source amendment. And so I guess my question is, what have we done so far under this contract? And obviously we're asking for another year of this contract. And I guess it's looking at child support guidelines. And then next year supposedly they're going to be available to testify for the legislature. But how much are we giving these people? How much have they done up to this point?
Sure. So Karen Hebert, I'm the director of the Division of Economic Stability at DHHS. So this complies with a federal requirement to do a quadrennial review of child support guidelines for all states. All states have to abide by that. So this particular vendor, the Center for Policy and Research, actually had done a full comprehensive analysis on the child support guidelines for the state of New Hampshire and issued a final report at the end of 2022. The report is available. I'd be happy to provide it to you if you'd like to see it. It's very comprehensive. It also includes a number of recommendations. So that report is provided to both the Senate, the House, the Governor's Office, and we also provide it to the Children and Family Law Committee so that they can take a look at the recommendations and determine whether or not there are any changes or proposals that they would like to make for legislation. So for example, one of the recommendations related to parenting, shared parenting formulas in the child support guidelines, because there isn't one in New Hampshire. So this particular vendor provided that report. This vendor has done the same analysis work for, I think, 43 states. So it's, like I said, it's very comprehensive. And then the legislature can make a decision if it wants to move on any of those recommendations to change the guidelines.
So this amendment is to do what?
This amendment specifically is to ensure that if there are questions from the legislature, because I am anticipating there will be a fair amount of activity around this particular topic, they will likely want to hear from the author of this particular report. So she has agreed that she would come back to New Hampshire. They're based in Colorado. They would come back to New Hampshire to testify and answer questions that any particular committee may have of her.
So if you go ahead and the legislature adheres to these recommendations, we will solve the child crisis here in New Hampshire.
Well, that's child care. I know that's on your mind an awful lot, but no, this is child support.
Child support. Okay.
So this is the monetary awards that are given by the court for individual parents to pay to the other parent for child support.
Gotcha. All right. I'm clear now.
Okay.
Thank you.
Any additional questions on item? Okay, well, sorry. Thank you very much. Hearing no additional questions, all in favor of item consent calendar agenda item 5A, please signify by saying aye. Aye. Any opposed? That item is approved. Okay, moving on, we have our regular agenda. I'm going to begin by asking for a motion to adopt agenda item 6 off of the regular agenda from the Department of Health and Human Services from the Office of the Commissioner. Any discussion? Hearing none, all in favor, signify.
No, I have a question mark here coming.
We'll give it a second.
Real quick.
Okay. So hearing no further discussion, all in favor of item 6. Oh, I'm sorry, Councilwoman.
Sorry, please forgive my laryngitis this morning. Commissioner, good morning.
Good morning.
I'm just wondering, when do you plan to get started or ground on this facility? Are we concerned about having adequate time to finish this up in time to use these funds?
Well, having this contract approved allows us to keep moving forward with our design, and as soon as the design is done, we'll then move towards a bid towards construction, and the goal is to be done by the end of '25.
Thank you. You and I have discussed that you have seen an increase in the number of gang members that are being held at the Community Youth Center, and that requires a certain level of separation in the facility. And I'm wondering if the design of this new facility is intended to accommodate that increase that we've seen in gang members.
Yes, that's part of the reason, this is very effective. That's part of the reason for the extra square footage is to be able to have that space to be able to move the youth appropriately so that we can keep sight and sound separation if needed.
Thank you.
Further discussion? Oh, yes.
Commissioner, good morning. What is the current census at the SYSD?
17.
Thank you.
Any further discussions on item 6? Okay, hearing none, all in favor of item 6, please signify by saying aye.
Aye.
Any opposed?
Nay.
Okay, with that, item 6 is approved. I'm going to now ask for a motion to adopt agenda items 7 and 8 from the Department of Health and Human Services from the Division of Children, Youth, and Families.
So moved. Second.
Any discussion on 7 and 8? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, items 7 and 8 are approved. Could I have a motion to adopt agenda item 9 from the Department of Health and Human Services from the Division of Behavioral Health?
So moved. Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 9 is approved. Could I have a motion to adopt agenda item 10 from the Department of Health and Human Services from the Division of Medicaid Services?
So moved.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 10 is approved. Could I have a motion to adopt agenda item 11 from the Department of Health and Human Services from the Glencliff Home? Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 11 is approved. Could I have a motion to adopt agenda item 12 from the Department of Health and Human Services from the Office of Health Equity?
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 12 is approved. Could I have a motion to adopt agenda item 13 from the Department of Health and Human Services from the Division of Long-Term Supports and Services?
Second.
Any discussion on item 13? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 13 is approved. Could I have a motion to adopt agenda items 14 through 22 from the Department of Health and Human Services from the Division of Public Health Services?
So moved.
Your second.
Were we going to?
No, I just need a second. We'll do that.
Second.
Thanks. Thank you. All right, now, Councilor Stevens.
We're going to break them down both contract by contract, correct?
Yes, if you oppose
Thank
any.
you.
If you oppose anyone, just let me know which ones you say no to. Discussion on any of these items? Councilor Warrington?
Yes. Items 16 through 22 are the family planning contracts. Currently, we have 4 family planning contract providers in the state. This is to extend those 4. We also have 3 contracts before us today. The family planning services, those contractors are not currently contracted with the state. I wonder if you could tell us how these programs reduce the likelihood of children in our state living in poverty.
Good morning, Governor. Good morning, Council. My name is Patricia Tilley. I'm the Director of Public Health. Thank you for the question, Councilor Warmington. Family planning services are an effective way to ensure that all people receive comprehensive and affordable reproductive health services. In particular, these services with Title X, there's been research over time, economic research over time, that it reduces the number or the percentage of childbearing among low-income individuals. And so that has a direct impact on things like Medicaid expenditures or expenditures for TANF and other ways that we use public funds to support low-income families.
Can you tell me how these programs reduce the likelihood of children being born into single-family housing?
Sure. So one of the things that comprehensive, again, easily accessible, affordable, comprehensive family planning services does is it allows individuals choice around their birth spacing and reproductive health. So families can choose to engage in the economic workplace, and it also promotes the planning that is necessary to choose when and how you want to have your children. So you can do that when you are in a settled relationship, potentially, and in a place where you can afford them. We all know the costs around children. Those are getting larger every day. Child care is on top of mind for everyone.
Thank you. And also the availability of contraception reduce the likelihood of children being born into single-family households.
Absolutely. And one of the things that our family planning programs do that are supported by these contracts is provide a comprehensive range of contraceptive options, including very effective, long-acting, reversible contraceptives. And so that allows families to have some security in being able to choose when they would like to have their family and add new members to their family.
Currently, the contracted providers that we have are serving 2,500 individuals in our state. How many would be served by adding these 3 additional contract providers?
But thank you for that question. We anticipate that we could serve an additional 5,000 New Hampshire residents if we could expand our services with the 3 new contracts. We're very proud of the 4 vendors we have right now. They do a great job. They're in rural areas. Half of them are in rural areas. Half of them are in more urban areas. But with the addition of additional vendors, we can serve more people.
So we could increase by 3 times the number of people that are served in our state. And in my district and in Councilor Stevens' district, there are actually no patients being served in those districts at all currently. Would they be served under this, with the addition of these new contracts?
Yes, we anticipate that the greatest increases would occur in your 2 districts. We're very pleased that one of our current vendors, Lincoln Healthcare, is also going to be expanding into the Newmarket and Raymond area. That's wonderful. But with 3 new vendors, we could serve additional people.
Can you just describe the types of services that are provided under these contracts?
Thank you. Comprehensive access to comprehensive contraception is primary thing that we often think about with family planning contracts. But in addition to that, we also provide cancer screenings. We also provide screenings for sexually transmitted infections. We provide preconception care. And so that's things like making sure that folks have access to tobacco cessation, making sure that they're at healthy weight so that when they're ready to have children, they're physically ready, and it's more likely that those babies are going to be healthy and mom is going to be healthy.
And that also includes referral for substance use disorder.
It does indeed. That's an important part of our work, and we certainly know that individuals that may have a substance use disorder are an especially important group for us to work with. We want to make sure that they have access to effective contraception so that they can plan for when a child is going to be at the right time for a child to come into their life.
And so that we won't have children born who are born to addicted moms.
That is correct. We anticipate that it reduces the number of infants born with something called neonatal abstinence syndrome.
I'd just like to focus in on the spike that we are seeing across the country and in our state in sexually transmitted infections, and particularly the increase in the incidence of syphilis. Can you talk about how much we've seen an increase in syphilis across our state?
Sure. So not only in New Hampshire, but across the country, there have been increasing numbers, incidents of syphilis. That number is growing. We are lucky here in New Hampshire that while the trend is definitely going in the wrong direction, we haven't seen the spikes that we have seen throughout the country. But right now, in addition to just the number of people who have syphilis, we're also seeing increases in something called newborn syphilis, or what has been known as congenital syphilis. To be very clear, we have not seen those spikes yet in New Hampshire, but we're seeing them elsewhere throughout the country. Just yesterday, I was on a call with all of the health officers across the country, and this is number one on their mind, is this increase in syphilis that they're seeing among young adults that are sexually active.
Are you concerned that failing to fund these services will exacerbate the number of newborn syphilis cases we have in our state?
We certainly know that access to screening and testing services and the education and outreach that these family planning contracts provide would help us to stem that tide and keep us in the enviable place that we are right now in New Hampshire with our relatively lower numbers. Again, trend lines are going in the wrong direction. We're not seeing it quite at the volume that we're seeing it in the rest of this country, but it may only be time unless we provide the kind of screening, testing, and education that's needed to ensure that we have appropriate prevention.
But we have in fact seen about a fourfold increase from 27 to 108.
Absolutely.
Syphilis in the state.
Yes.
Can you describe the effects of congenital syphilis on newborns?
Sure. So congenital syphilis is very dangerous to the newborn. It can result in premature birth. It can result in infant mortality and babies dying. Among those babies who live, they can see developmental delays, issues with their bones, anemia, other birth defects, blindness, deafness. It's very concerning.
And the best way to fight the increase of newborn syphilis is to make sure we screen for and treat syphilis, STIs, and fund these contracts. Is that right?
We believe that one of the ways to impact those numbers and reverse the trend that we're seeing is to increase screening and testing and education and outreach.
And a vote against these contracts is a vote against the health and well-being of the people of our state, including newborns, and particularly the poorest people and the most vulnerable people in the state. Is that right?
We are certainly concerned about those folks that do not have access to affordable health care. And that's what these contracts do, is it enable everyone to get the sort of comprehensive reproductive and sexual health services that we all need.
Further discussion? Councilor Stevens?
Ms. Tilley, thank you so much for speaking with me. Thank you for clarifying the disparity and the changes in the scoring. But the data is consistent, going from 10 to 4. It's just condensed in those 4 categories. We discussed the contractor share. There is a contractor share for all of these providers. One of the issues of concern to me are the maternal mortality rates in the state of New Hampshire. And the Maternal Mortality Review Commission has cited substance use disorders as contributing factors for more than half, correct?
Absolutely. So both behavioral health issues, that's both substance use disorders and mental health conditions. We know that about half of our maternal mortality cases are related to either suicide or overdose. And so programs like this that can provide individuals with the screening, the preconception care that they need, as well as the contraception so that they can decide the timing and the spacing of their children certainly helps. We want to make sure every woman gets the care that they need.
I went to look at the financials, and 990s you can extract certain information. Again, the financial documents. I reached out to the Charitable Trust Unit, and it was disappointing, very, very disappointing. And within the past few months, this is not the first time that discoveries have been made. And unfortunately, one of our providers today did not file their annual report for 21 or 22, and we understand that waivers extensions for 23 are very common. I also found that there were challenges with another provider opening their file to review. But I just want to say it is extremely disappointing to not be able to review charitable trust documents for candidates that come before us.
Thank you, and I will note.
Sure. Yep, I can respond to that. So, yeah, Counselor, I know what you're referencing that in the course of your discussions over the last few days with the director of the Charitable Trust Unit, we realized that one of the providers, Planned Parenthood, had not filed their annual reports for 21, 22, and 23. The 23 deadline is very recent, so that's November 15th. Each year, any charitable trust is required to submit an annual report to the Charitable Trust Unit, and that annual report has to include the 990s, which are the tax returns that charities file with the IRS, and audited financials. When we realized these reports had not been filed, we reached out to Planned Parenthood. They were very responsive. The 21 and 22 forms were filed yesterday. So those forms have been filed. An extension was requested for 23. That was granted. So they are back in good standing. I understand your concern with that, and I share your concern. We don't want any charity or charitable trust not to be in compliance. And speaking with this particular charity that explained to us they had a former CFO, a transition in that position. They thought these forms had been filed. They weren't. The fact that the forms were filed immediately did give me some assurance that they could have filed the 990s with the IRS. So it was a mistake. This happens. We're going to continue to follow up with them to ensure that they have processes and procedures in place to ensure it doesn't happen again. But I understand the concern, and we are working to continue to improve our systems to make sure we don't have these holes. We've begun accepting electronic filings. We did that in 2021. For the last couple of years, we've been digitizing all our files. We now update a list every 2 weeks on our website of charities and their status, whether they're in good standing or not. That's why we were able to discover this issue so quickly in your conversation with Director Quinlan. We're continuing to improve our system to audit this to make sure everyone's in compliance, and we are making really good progress on that front, and we're getting there. Up until a few years ago, the Charitable Trust Unit that oversees over 12,000 charities in the state, everything was done by paper. So we've made a lot of progress in improving these systems, but I say all that to respond to your concern. I understand it. We certainly regret that there was this oversight both on our part. We're also concerned with the fact that there was this oversight on the part of this particular charity. We're going to work with them to ensure it doesn't happen again.
Follow-up. It is very frustrating because it does not paint the full picture. It's not fair to the entities as well. It really makes decision-making challenge when either you cannot review the documents. So I hope charitable trusts, the statement yesterday was that the commissioners or the agencies need to check with charitable trusts before they put a contract forward. But it's a disservice to all nonprofits. So I hope this can be resolved.
Yeah, one step we are going to take, if we can take that immediately, and we're now in a good position to take that, given the improvements to the system, is that right now, any entity that contracts with the state has to include a certificate of good standing as part of their packet with the contract, so that we know they're in good standing with the Secretary of State. We're going to add that, an additional step, which is that there needs to be a check status for any nonprofit or charity that contracts with the state, check their status with the CTU. We're now in a position to do that, given the updates to the system. We frankly wouldn't have been in a position to do that a couple of years ago. We're now in a position to do that, so we're already convening to make sure we add that to the contracting process. So that should be done soon, within the next 1 or 2 contract cycles, I would say.
Thank you very much.
Yep.
Councilor Warmington, do you have further
Just to follow up on that, Attorney General, this is exactly the same problem that we encountered with Seven Hills, where they hadn't filed. It was noted that they hadn't filed. They submitted their filing, and this council approved the contract.
Yes, that's correct.
And the other 2, I've identified one that was delayed in making their filing, but the other 2 providers that we're considering today, the new providers, were in good standing. Is that correct?
Yes, that's correct.
Any further discussion? Councilor Stevens?
Yeah, I'll echo what Councilor Warmington had to say, but the challenge was opening the document. The other 2 providers did meet the deadlines, but accessing that information again was a challenge. Another question for the Commissioner? There was a 4th bidder on site who we know very well from the work that they did in establishing and citing vaccine clinics. Can you discuss what was proposed, or is that not?
I don't think I discussed what was proposed.
Okay.
I mean, we could tell you that they submitted a proposal and then withdrew it.
Thank you.
Just to be clear, I think we can disclose that it was withdrawn.
Well, I just did, so.
They withdrew it, so it was a withdrawn proposal.
If there's no other discussion, I just want to ask one clarifying question. How much money out of all the funding here goes to fund abortion services?
None.
Thank you.
Okay. Any further discussion? Okay, well, look, as I've said in the past, I'll put these contracts on the agenda in the hopes that they will pass. I know it's always a challenging issue for a lot of folks, but I think as Councilor Warmington and Trish really pointed out, it is about preventative health care services for a lot of these vulnerable and low-income families. So here's hoping it gets done. All in favor?
Governor, do we have a roll call?
A roll call on every item?
Family plan.
Sure. So, yeah, we can do that. Bear with me 1 second here. That would be. It's 16 and on, right? Great. Okay. So, all in favor of items 14 and 15, please signify by saying aye.
Aye.
Any opposed? Those ones are approved. We'll do, Secretary of State, let's do a roll call on 16.
Councilor Kennedy?
Yes.
Councilor Warmington? Yes. Councilor Stevens?
Yes.
Councilor Gabbard?
Yes.
Councilor Wheeler?
No.
With that, item 16 is approved. Could we get a roll call on 17?
Councilor Kennedy?
Yes.
Councilor Warmington? Yes. Councilor Stevens?
Yes.
Councilor Gabbard?
Yes.
Councilor Wheeler?
No.
With that, item 18, I'm sorry, item 17 is approved. Could we get a roll call vote on item 18?
Councilor Kennedy?
Yes.
Councilor Warmington? Yes. Councilor Stevens?
Yes.
Councilor Gabbard?
Yes.
Councilor Wheeler?
With that, item 18 is approved. Right. Right, okay. Could we get a roll call on item 19?
Councilor Kennedy?
Yes.
Councilor Warmington? Yes. Councilor Stevens?
Yes.
Councilor Gabbard?
Yes.
Councilor Wheeler?
No.
With that, item 19 is approved. Could we get a roll call on item 20?
Councilor Kennedy?
No.
Councilwoman? Yes. Council Stevens?
No.
Council Gavin?
No?
Council Bill?
No.
With that, item 20 is not approved. Can we get a roll call on item 21?
Council Kennedy?
No.
Councilwoman? Yes. Council Stevens?
No.
Council Gavin?
No?
No.
With that, item 21 is not approved. Can we get a roll call vote on item 22?
Council Kennedy?
No.
Councilwoman? Yes. Council Stevens?
No.
Council Gavin?
No?
Council Bill?
No.
With that, item 22 is not approved, and that concludes our items from public health. Trish? I'll now ask for motion to adopt agenda item 22A from the Department of Health and Human Services from the Division of Economic Stability.
So moved. Second.
Any discussion on 22A? Council Kenny?
Thank you. Commissioner, how are you? So I've received a lot of inquiries about this particular contract with child care. Substantial amount of money. What are we trying to accomplish, and how are we targeting this funding to child care centers? And do the child care centers have to request this money, or does it automatically go out to child care centers? How are we delivering this service?
I'll let Karen step in and give you all the details.
Good morning again. Thank you for your question. So this particular item originated from HB House Bill 2 in the legislature. So the $15 million in this is intended to be used for recruitment and retention strategies for child care providers to strengthen that so we can ultimately increase the number in that workforce to then increase the amount of the capacity, the number of child care slots that would be available for families, so more people can have access to child care throughout the state.
So in terms of recruitment and retention, are we driving that train, or is the individual child care centers driving that?
So HB2 basically set out a list of allowable uses specifically for these funds. So the providers get to basically choose which use they're going to adopt. And then we will be tracking, we will be asking for some baseline data in the beginning from all of the applicants to understand where they're at with respect to their current workforce, their current staffing. And then they'll be required to report at the end of the period about the changes, if any, that have been made to try to demonstrate the effectiveness of this particular item.
So will that information be provided on New Hampshire Connections, or will it just be provided to the department?
Which information?
The information that you just described, when it's all collected at the end of this grant process?
Yes, we will publicize the information.
Will it be on New Hampshire Connections?
And the DHHS website, yes.
Okay.
Mhm.
Great, I would like to see a copy of that. So we're looking at about a year for this program to run its cycle?
They have until June of 2025 to be able to meet the requirements in this, and then we will be providing them with a template to issue an interim report and a final report for the department to basically look and see, so we can analyze that information.
Okay. Well, it's a step forward, and glad to see the legislature taking this great topic. So thank you.
Thank you.
Any, Councilor, what were you your hand? Sorry.
Second to the last paragraph, the last sentence. We set forth the formula in this paragraph for distributing the money. In the last sentence, it says the department reserves the right to make adjustments to the formula if necessary. Can you explain that?
Sure. So we actually worked with the Child Care Advisory Council to come up with this particular formula, and they did agree that this was the most fair and appropriate formula to use for the provider community. However, we just wanted to make sure that if we needed to make any particular change to that formula, so for example, if we had a very tiny number of applicants, which is unlikely, but if we did, then we want to be able to take a second look at the formula and see if it should be adjusted based on any particular, really small number of applicants, if that were to happen.
So I don't want to hold this up, and I want to see you go forward, but I wonder if we could just say that if you make any adjustments to this formula, that you would report that back to this council.
We can do that.
Councilor Stevens?
While we're on the topic of scholarships for child care centers, isn't there a deadline tomorrow or 12/1 for the operating expense reduction grant program, correct?
I believe that window does close tomorrow.
Yeah, so I'm hoping, I'm trying to get the word out, that final push, that the deadline is 12/1/23 for the operating expense reduction grant program, so one can still file and apply.
Yes. Right now, we have 218 applications as of yesterday, so that's great.
Thank you, that was my next question. Well done.
Additional comments? Questions? Okay, all in favor of item 22A, please signify by saying aye.
Aye.
Any opposed? That item is approved. And that concludes our items from Building and Services. So do we have a... Are you not believe it?
I think I'm all done. No late items.
Okay.
Thank you.
I apologize. Okay, moving on, could I get a motion to adopt agenda items 23 to 30A for the Department of Transportation? Any discussion? Councilor Wheeler.
Question on item 30.
Sure. Bill's here. Morning, Commissioner.
Morning, Governor. Morning, Councilors. Bill Gaskell with the Hampshire Department of Transportation.
I'm excited that you're here. You're going to be here for a while.
Birthday.
There you go.
On item 30, could you just assure me that I didn't see anything in this contract for the disposal of the ties that are hazardous waste and the rubber membranes and stuff from the crossings, that those costs are not on the state or on the railroad operator, that it is indeed somehow in the contract, even though it's not specifically stated?
Yes, I can assure you of that. So, under the prosecution work in the contract, we have an item where we salvage materials to the state. So we are salvaging all of the signal equipment and any of the actual rail and things that we can reuse, high plates, joint bars, and other track material like that. Under the specification 690 within the contract disposal of materials, everything that isn't salvaged to the state becomes the property of the contractor, and it's required them to dispose of it properly. We ensure that they dispose of it properly. So that primarily is the rubber gaskets and the ties, which will be on the contractor to dispose of, but it is covered by the specification.
And I just have a comment to follow up, Governor. This is a very expensive project, and I am not convinced using tubs is the right idea. And makes these projects very expensive, because CFX just replaced several crossings in Milford. They only tied up the intersection for one day, making these crossings. And I'm sure they didn't spend $3 million a piece, so, well, this is a signalized crossing. I'm sure that they didn't spend this kind of money, so I think we really need to rethink whether there's a cost benefit to using tubs and making this so expensive, and also limiting it basically to one bid.
Okay. Councilor Gatsas, do you have a question?
Just checking. 4A.
There are two items on the agenda relative to 4A, both right-of-way awards as we continue securing the property rights to advertise and construct the next project. So item 23 and 24 both involve right-of-way payments to affected property owners as we continue to secure the rights to advertise the next project next spring.
And how can you slow down 4A?
The construction or the design. We continue to work through design issues, so it's not necessarily slowing down, but issues come up and we try to deal with them and reconcile them and move on. So.
Okay, thank you.
Further discussion for DOT? Okay, hearing none, all in favor of items 23 through 38, please signify by saying aye.
Aye.
Any opposed? Those items are approved. Thanks, Bill.
I just like to say thank you for your continued support. I do appreciate it.
You bet. Thank you. So I'm now going to ask for a motion to adopt agenda item 31 from the Office of Professional Licensure and Certification.
So moved.
Second.
Any discussion on item 31? Council Warmington? The director. Morning.
Good morning, Lindsay Courtney, Executive Director of PLC. I'm just wondering why these positions will not be permanent. We did actually secure, I think, 10 permanent positions, but we are anticipating, as a result of our leveraging technology and our migration to the new licensing portal, that at some point it may not be necessary to have all of these positions filled. I'd also like to ask about the status of the mental health worker rules that we talked about at the August meeting. So I'm going to ask for those to be brought forward by September the 1st. I'm going to know the status. Yep, they filed their initial proposal back in September after securing the fiscal impact statement by September 1 as required, and it should go to the jail car hearing on December 21st.
Councilor Stephen?
Thank you very much, Commissioner. Next time on these sorts of contracts, could you just total within the content of the description what the total cost is for these positions? But on another topic, I want to thank you for stepping in and assisting a nurse who had completed nursing school and was unable to take the NCLEX exam because she was on the front lines of fighting COVID. And then when she did go to take the NCLEX exam, she was told, you can't sit, go out of state. And when she looked into taking the exam in Maine, she was told she would have to be a Maine resident. We came pretty close to losing a nurse here in New Hampshire. And I really thank you for intervening on what is an old, archaic rule, which penalizes those wanting to sit for this national exam. So thank you.
You're welcome. Thank you, Councillor. Happy to always assist constituents. We are working on that long-term solution. In terms of the total cost,
I figured it.
Okay, great. Thank you.
Any further questions on 31? Okay, all in favor of item 31, please signify by saying aye.
Aye.
Any opposed? That item is approved. Could I get a motion to adopt agenda item 32, that is State Treasury?
Second.
Any discussion? Councilor Kenny, I think the Madam Treasurer is here.
32 and 33.
Oh, yes, I'm sorry, 32 and 33. Yeah, can I get a motion to adopt agenda item 33? Thank you. Good morning.
Good morning, Governor. Good morning, Councilor. For the record, State Treasurer Monica.
Nice to see you. So, you have an explanation in your Agenda 32. It's the most efficient way for any MDB to invest its required debt service reserve fund is in a fixed income environment is to purchase the state of New Hampshire general obligation bonds as an investment. Can you explain to me what that is all about?
Yeah, so technically, when the New Hampshire Municipal Bond Bank issues bonds, they're required to have a reserve fund as part of the transaction. So there are limitations on the type of investments that they can use for that reserve fund, and it's typically two types. There's what's called state and local government securities issued by the U.S. Treasury, and there are other, I guess the other type that is easy for the bond bank is a New Hampshire bond. So that's why, and because we are essentially affiliated, it's an easy transaction. So it's a private placement. We issue bonds, the state of New Hampshire issue the bonds directly to them. They purchase them directly. And I guess the word of the efficiency of this transaction is the fact that they save money, and we also save money because we don't have to go out to market to issue the bonds. This is a small transaction that essentially assists them in that process. We gain, they gain as part of this process.
So $3 million is a small transaction?
It is a small transaction for, so the bond bank issues large transactions, so they actually allowed to issue about $23 million in bonds. to finance a few projects the municipalities have. So the 3 million is the reserve fund. So that's a small, again, portion of the total bond issuance that they're planning to do.
Okay, thank you for that answer, appreciate it.
My pleasure.
Any further discussion with the treasurer? Okay, all in favor of items 32 and 33, please signify by saying aye.
Aye.
Any opposed? Thank you.
Thank you.
Treasurer.
Absolutely. Thank you.
I'll now ask for a motion to adopt agenda items 34 and 35 from the Community Development Finance Authority.
So moved.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? With that, 34 and 35 are approved. Could I get a motion to adopt agenda item 36 from the Department of Military Affairs and Veteran Services?
So moved.
Any discussion? Councilor Kenny.
Good morning. For the record, Warren Perry, Deputy Adjutant General, New Hampshire's Department of Military Affairs and Veteran Services. Good morning, Councilor.
Good to see you again. Thank you for that presentation this morning at the breakfast meeting. I believe I'm looking at item 36. And this is the expansion project that's going on at the cemetery, the Holland expansion, which I guess is creating several thousands of niches for veterans. When it comes to actual full-length burials, how many people have we buried veterans, and are we going to expand that side of the veterans cemetery as well?
So this particular expansion is, as you mentioned, mostly for cremated remains. So there's about 3,500 to 3,600 in-ground cremation spots, and then the column niches. So we still have plenty of space in the full casket burial piece. So a couple of years ago, we did an expansion where the VA funded pre-placed vaults on that other side. So it's about a third full. What we're finding is about 75% of burials right now are cremations. I think it's economical for the veterans' families. I think more people are trending that way. When we did have the pre-placed vaults, it saved about $1,500 per burial for the family to come and do that. So there was an uptick in full caskets, but we have plenty of full caskets. And future, and we manage the expansions based on what the demand is generally in the mix. So we have, in terms of acreage, we have enough acreage to expand the cemetery to get us to about 2095. So we have plenty of space. This particular one gets us 10 years of cremated.
Thank you, I appreciate that information.
Any further discussion? Okay, all in favor of item 36, please signify by saying aye.
Aye.
Any opposed? 36 is approved. I'll now ask a motion to adopt agenda items 37 and 38 from the Department of Agriculture, Markets, and Food.
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Those items are approved. Could I get a motion to adopt agenda items 39 and 40 from the New Hampshire Insurance Department?
So moved.
Is there a second?
Second.
Second, thank you. Any questions on items 39 or 40? Okay, hearing none, all in favor of items 39 and 40, please signify by saying aye.
Aye.
Any opposed? Those ones are approved. Could I get a motion to adopt agenda items 41 and 42 from New Hampshire Employment Security?
So moved.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Those are approved. Could I get a motion to adopt agenda item 43 from the Department of Corrections?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 43 is approved. Could I get a motion to adopt agenda item 44 from the New Hampshire Banking Department? Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 44 is approved. Can I have a motion to adopt agenda item 45 for the Governor's Office for Emergency Relief and Recovery?
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Item 45 is approved. We do have a late item from the Governor's Office for Emergency Relief and Recovery. So with the indulgence of the council, I'd ask to have a motion to adopt a late item B as presented from Gopher. Let's start with the motion.
So moved.
Second. Thank you. Motion and a second. And maybe the commissioners here, because it is a late item, I guess I would ask if the commission just for public notice, public transparency, so to say, just a quick summary on this item. Sir, thank you.
Taylor Caswell, Director of Gopher. This item came to our attention as basically, it's under the municipal boat launch program that Gopher has been administering. It's a $100,000 grant for the town of Wolfboro. The request came as a result of the need to get some construction completed before water levels were changed on the lake to save some money to the town. So we had planned to bring this item to your December 20th meeting, but we were requested to move that off of the 20th and bring it out here today so that they can get their construction underway.
Great. Great. Any questions? No? Okay. Hearing none, all in favor of late item B, please signify by saying aye.
Aye.
Any opposed? That item is approved. I'm going to now ask for motion to adopt agenda items 46 through 53 from the Department of Business and Economic Affairs.
Second.
We have a motion and a second. Any questions on any of those items? Councilor Wheeler.
Sure.
On item 50, it seems like it's missing some detail here. How did you come up with a $300,000 a piece? Is that the complete demolition, for the recipients? And they have to, is the project bigger than that? Is the project smaller than that? It's just unusual that they're both the same number, so there must be detail missing.
I believe 300,000 is the cap of the program, so that's the most that they could get. Is that correct? So they qualified for the maximum request for that. It's matching cost for the
How do you know they needed 300,000?
Well, I mean, there's a very long process that we have to go through to understand what it is that they're applying the money for, how many units it's going to create, those sorts of things.
That's the detail the council didn't get.
Okay. Well, I mean, I don't have like the full list of how exactly all of those decisions are made. We've been bringing a number of these forward now, as you know, over the last couple of months under the Invest in Age Demolition Program.
Sorry. No, please.
The item says they have to follow certain rules, and what I want to know is in those rules, do they have to put that demo out to bid? Or I don't know if they're going to be...
Yes, I believe they do.
What?
It depends on the town rules for that, in that instance.
Only if the town wants to, is that what I heard?
Councilor, Director, St. Deputy Director, Division of Economic Development at DEA, the town would have to follow its own rules relative to putting out to bid. That is not a specific requirement of this program based on the federal rules.
So why don't we require that to make sure our taxpayer money is spent wisely? Why don't we just say, whatever you want to do, go ahead?
It's not so much whatever they want to do, it's whatever rules they have in place already, so the town should have its own.
Why don't we require it? That's the root question. Why don't we require it? You're taking our money, we will put this job out to bid. Not just give it Uncle Charlie.
Can we require that over and above?
We could require it over and above, yes.
I think we need to change our ways.
How many of these grants have gone out? Ballpark? A dozen?
A couple million worth of grants already.
Under the demo program, I have that number right here. We have requests in for $1.9 million in that program. And I don't have the numbers to how many have passed through.
So I'm assuming a few dozen.
Yes.
There's more coming?
Yes.
So will you require them to go out to bid on the next one?
I think the pipeline that we have in process right now is under the rules that we've been administering the program to date. If we were to change the rule going forward, it would be anything prospective or any additional funds that we might put toward that program, we could make that change.
So we could potentially do it for the next round, if we did another round.
Yes.
Thank you.
Okay, further discussion on any of these items? Okay. All in favor of items 46 through 53, please signify by saying aye.
Aye.
Any opposed? Those items are approved. Could I get a motion to adopt agenda items 54 through 57 from the Fish and Game Department?
Second.
Any discussion?
Just cover it, if we could just keep the director around for item 107.
Sure.
Question.
Deputy Sean.
Item 107.
Hang out. Any other questions on 54 through 57? We're okay. Moving forward. All's well. Taxes today. All in favor of items 54 through 57, please signify by saying aye.
Aye.
Any opposed? Those items are approved. I'm now going to ask for a motion to adopt agenda items 58 through 72 from the Department of Natural and Cultural Resources. So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Those items are approved. I'll ask for a motion to adopt agenda items 73 through 90A from the Department of Environmental Services.
Second.
Second. Motion and second. Any discussion? Councilor Kenny. Rainey's here. Bob. Hey, buddy. How you doing?
Good night.
Good. Good. Excellent. The cane matches your suit.
There you go. Thank you.
Barely tell.
I didn't get a real cane yet. It's just this temporary, so I'm not going to use the cane.
Ask Sam. Sure.
For the record, Bob Scott, Department of Environmental Services.
Commissioner, good to see you today. So I have a question on Henry to just for the city of Dover. It's the Henry Law Park Stormwater Treatment System Project. So it's a lot of money. It's capturing a huge area. And for the council's recollection, we were there this summer. Government council meeting, there's a park out front of the amphitheater that's called the Henry Law Park Stormwater Treatment Park, I should say. Can you explain this project, because I wasn't able really to capture the meeting's contract of what's happening in the duration of this project. Do you have a sense of is it going to be any interruption in downtown Dover, or what is this project going to consist of?
Well, I may ask Randy to come up. I don't know if he has any better, again, some context. So Dover is one of the MS4 communities in the state, so they've done a lot of work on stormwater work, and that's, again, related somewhat to the nitrogen reduction that we need to see in the Great Bay. So they've actually been one of the leaders in the state for the work they're doing on this, and they're pretty progressive, which may be what you're talking about also. So before I ramble on, I don't know if Randy has any more detail of the exact project, and I apologize.
Why don't you go sit down? I told him to stay. Yeah, so what's going to happen is they are an MS4 community, so they will be working in the streets. They got some drainage, they got some culverts they're going to have to install. What this whole project is based on, like all of the MS4s, and there's probably 14 or 16 in the state, where they've got to stop discharging to a surface water without having some sort of treatment before it goes. So Dover's been really proactive in their stormwater issues and treatment, and And this is a large area that's going to be captured, but it's going to clean up a lot of what being discharged to the river, so it's a great project.
So in conjunction with that, we last year passed, a permit to allow the, Riverwalk Chico project to go forward. Is this going to be a part of that project as well?
This whole project is going to look at everything in that Henry Park stormwater that it's a direct discharge, otherwise it isn't collected and treated. It will take care of that boardwalk area as well. Anywhere that rain falls on impervious surface that isn't collected hydraulically, it will be picked up in this. That's why it's such an expensive project.
And is the city of Dover still pursuing a storm collection fee? Are they still moving down that line?
Yeah, I think a lot of towns are looking at stormwater utilities. The legislature passed a law, probably 2 or 3 years ago, that allowed those kind of utilities to go in place. Stormwater is a big ticket item in a lot of municipalities, and I believe Dover is still moving in that direction. It's kind of like people that live in cities, they pay for wastewater, they pay for drinking water. And one of the major polluters that we're seeing now across the state is stormwater. Stormwater is a big issue. Years ago, it was always wastewater that we always addressed. Most of that has been addressed, especially with all the money spent on upgrades. Now, the big focus of cleaning up rivers, lakes, and ponds is stormwater.
There's money in that stormwater, okay? All right, thank you, I appreciate it.
Thank you. Councilor Steve?
Question on 86, a dock permit. The Town of Guilford Conservation Commission responded that they did not see plans of a cross-section, a proposed dock showing water depth, or the proposed seasonal docks, how they would attach to the shoreline frontage. And they were hoping to see revised plans and they would sign off. Do you know if plans were revised and delivered to them?
I do not know. Is this Faith Boyad you're talking about? No.
No. Fairview condominiums?
Shoreline.
I will look. I'm not aware of whether it's done.
Thank you.
I'll send you the council an email.
Oh, thank you. Any further discussion? All right, Bob, what's it? Thanks for being here.
Can I just note that in paragraph 9 of item 86, it says the Conservation Commission received the revised cross-sections and determined the project met their criteria. In paragraph 9. So,
Thank you for clarifying.
Great, thank you. Okay, all in favor of items 73 through 90A, please signify by saying aye.
Aye.
Any opposed? Those items are approved. I'll now ask for a motion to adopt agenda items 91 and 92 from the Department of Education. Could I get a second on 91? Oh, thank you. So we have a second. Any discussion on 91 and 92? Hearing none, all in favor, signify by saying aye. Aye. Any opposed? Those items are approved. I'll now ask for motion to adopt agenda items 93 through 98 from the Department of Safety.
So moved.
Any discussion? 93 through 98. Hearing none, all in favor, signify by saying aye.
Aye.
Any opposed? Those items are approved. Can I have a motion to adopt agenda items 98A through 110 from the Department of Administrative Services? Correct. Any question on these items? Let's start with Councilor Kennedy.
Hi, I'm Charlie Erlinghouse. I'm the Commissioner of Administrative Services. How are you?
So good morning. So on this hatchery modernization project is this a whole new hatchery? Is this a remodeling?
There's
Exactly is it?
Well, and sadly Ted is sick, so he could tell you a lot more details about it, and I think probably the director can tell you about it, but my understanding is that there are federal compliance issues, and that in order to comply with them, and I'm going to actually ask the director to come up and tell you the details about it, but I think it's functionally a whole new hatchery.
So,
and he can tell you why we picked that.
Morning, Director. So, good to see you, Director.
Good morning. The record, Scott Mason, Executive Director of Vision Care.
So we had a discussion at one point about this new hatchery, but I just want to make sure the public knows what it is and what it's not.
So,
can you explain what it is?
Sure. So I'm sure everybody here remembers that a few years back, we ran into some issues with re-permitting our deputies permit in the New Durham hatchery. As we hired a company to work with us to study the issue, and I should also remind you that EPA saw fit to give us a 12 part per billion phosphorus discharge permit, and that, as of today, is still the lowest permit in the United States for hatcheries. So as we hired the engineering firm to look at what we would have to do at New Durham in order to meet that requirement, the end result is that we would probably have to spend more money in New Durham, and we would have to, they could not guarantee us that we would be able to hit 12 parts per billion month by month, which is what our permit is. So as we looked at our other facilities, it was apparent that an investment in New Hampton would probably be better usage of Gopher funding. And what we are planning on doing is we will reduce the production at New Durham in order to meet the EPA 12 parts per billion. And we will build a larger hatchery at New Hampton that will still be able to meet the discharge permits there. And we should be able to, we're planning on going from, and I apologize, I don't have the right figure on the top of my head, but roughly from a 70,000 pound facility to a 150,000 pound facility. So we should be able to make up for the loss that we had at New Durham.
And we spoke about what the future of the fish hatchery system might look like, but one of the things that you emphasized, it has to be modernized.
Yes, we are, and this hatchery, it's not going to look like the hatcheries that we have currently. I actually do have a handout for you folks. This is Diane Timmons, she's our Chief of Inland Fisheries. We're going to be installing what they call a RAS system. Our current hatcheries have like a flow-through system where the water just flows through the raceways or into the tanks. This will have a RAS system where the water will be filtered and then reused so that we'll actually draw less water. For the same number of fish, it will take less amount of water that will be able to raise those fish in, which in turn means we treat less water as it leaves the hatchery. One of the issues, the real issue that we face is that when these hatcheries, I think the newest one is in Milford, that was about 72 or something like that, I think it came online. All of this data predates the Clean Water Act. Nobody ever thought about where the water went after it left the hatchery. The concern is having quality water, and some of these hatcheries are so old, the concern was having gravity because it predates electricity. So our locations are really based on those two issues, is volume and quality of water, and then, gravity flow. So as we move forward, we need to start thinking about where the water is discharged into, and that, some of our hatcheries may be moved.
So is it fair to say that fishing in New Hampshire is kind of an economic development driver for trout and tourism?
Yes. I think the best example of that, Diane was very creative, and so in the old days, we used to do stock fish. A paper ticket was just, was written out, thrown on the dashboard of the truck. Eventually they get gathered up. Diane's created a system where we now have iPads in the trucks. The stocking crews, put where they're stocking fish, how many fish they're putting in. That gives us up-to-the-minute data at headquarters. There's a time delay before we put it out to the public, and then the public can get on a web page and see, not specifically where we stock the fish, but like a section of the river or a name of a pond. And I think it was 3 or 4 million hits within the first 60 days that web page was up.
Yeah, it's interactive, so you can, if you're a person that's going to visit the state of New Hampshire, you're going to visit Meredith, you can type in on the interactive map, I'm going to Meredith, and it will show you where your stocking sites are and what types of species, etc. It was an opportunity for us to enable the public to embrace the recreational opportunity.
So I can't guarantee you that it's 3 or 4 million tourists coming to New Hampshire, or whether it's just 6, 12-year-old boys that check every place that we stock fish at. But I will say this, is that I think it is a good indicator that when people come to, our own residents and people come to New Hampshire, this is one of the things that they certainly are interested in.
And my last question, you mentioned the distribution system with tanks. They control the hatcheries, put the fish in the tanks and
Well, one of the other issues we have in New Hampshire is that we actually stock in a lot of fairly remote locations. So we don't have the flexibility, like I have a 10-wheeler truck that has a stocking tank on it, but a lot of our locations I can't get to with that truck. I have to have a much smaller truck, which in my opinion, we have to balance the efficiencies of size and scale of the hatchery with the efficiencies of distributing those fish and getting those fish stocked in rivers and ponds.
Okay, thanks.
Thank you. Any other questions? David? Councilor, sorry.
I know recently that I'm concerned about I'm certainly behind this project, but I'm concerned about, we had a little discussion this morning about how we got here and the lack of involvement from the commission. I know recently that, the AG has determined that your budget has to go before the commission, and it hasn't yet. So this is a new, out of budget set, basically, $7 million project. Did the commission vote to do this?
The commission has not taken a vote on this. The AG office has informed me that I actually don't need a commission vote to move forward with the project. We have kept the commission in line with what we're doing. One of the problems that we've had is because of the lawsuit, we have not been able to move as freely as what we want, but we are now at a point where we can publicly talk about what our settlements are and where we're moving.
We are presenting to the commission at the next meeting. This information.
The next time the commissioner is told, I can't tell you about that, you better tell them why. I mean, the commission needs to stay involved.
Absolutely.
All right, thank you.
Any further discussion for these DAS? Okay, all in favor of items 98A to 110, please signify by saying aye.
Aye.
Any opposed? Those items are approved. We have a couple more, but before we get to that. Uh-oh, Counselor, what? What are we missing? Counselor Gadsden.
Looking for an answer on the Coney.
Oh, here we go. There we go. No, that's good. Good question. Hold on one second. Good. Just quick one second. Go.
No, go ahead, take the kid.
No, it's okay. Okay. This will not be brief. So, we do have some friends of Councilor Wheeler's here today from Amherst.
Amherst, and a lot of them fish. So they
A lot of them fish. These are those 12-year-olds that were on the website looking for the stocking location. Doing their best.
I guess when you go home to your parents tonight, you can say something was fishy at the governor. Yeah. We're here at the table seriously. The state of New Hampshire raises fish and stocks rivers and lakes and brooks, and we have to deal with the fact that fish make poop. And to keep you the water clean. We need new modern hatcheries that will filter that out, in short, of what the director said. So that's the project that we're voting on this morning. It was very expensive. That was $7 million. You guys having fun today? Yeah. All right. Would you like to meet the governor? Yeah. So how about if you go this way, single file, and you can shake the governor's hand.
I'm not doing that. That's all they're going to
Are we concluding the meeting? Mr. Arlen, give us an update on our favorite project in the state.
So January 15th,
It's
And
going
what
to
does
be,
that date mean?
that's when we're going to close. 15th.
Close on that date? Is it a non-refundable deposit?
Can I get back to you about when they can fund and not fund? I don't think it's full.
Well, I would assume that's going to be in the agreement.
Yeah, I just don't know off the top of my head. I mean, there are circumstances under which they can get the due diligence money back, and circumstances under which they can't. And I don't want to say publicly by guessing what those exact circumstances are, but I think they're outlined in the purchase and sales agreement.
we can get that.
Yeah, absolutely.
And what is the purchase and sales agreement at this point?
It's not exactly sure what the question means, but it's on the website.
It's already out.
No, P&S you voted on it last December.
But you're talking about the closing. Where are we, I don't mean to speak for you, Councilor, but where are we on some of the final items to get
They
to
want
the
to put
closing?
down November 9th as a
Well, I did.
date, and we've gone past that. So
We have.
We have gone past it, yes. I mean, so we're working with the buying team to finalize all of the items. What has essentially happened since the last meeting is that I told you that we were working on finalizing an agreement on a handful of items. And I would say that where we are is we are in agreement on everything. And what we've done with the buying team is, and it's lawyers talking to lawyers, right? But is to say, can we agree that we agree? And we do agree that we agree. And so what we're doing is just writing all of those things up. Because a lot of things, drainage easements and septic arrangements and all these little things are going to appear in the closing document. And so what will happen is there'll be minor wrangling over the precise wording of that. And I don't mean, but we're in agreement that we agree.
My understanding is the group is not acting like buyers.
I don't, that's not our experience with them. In what way are they not acting like buyers? They want to buy the property and they're trying to close all the title issues. That's all we know. I mean, if you know something else, I'm happy to go back and look at it, but whenever we talk to them, they're very professional lawyers. And they act like they act like they're buying the property, and we act like we're selling the property.
So January 16th, if they don't close, we put the property back on the market.
Okay.
We could,
Yeah.
yeah, we could, you're right.
Is that a yes?
Yes.
Governor?
We could. If we, look, to be honest, if we don't hit January 15th, if the issue is we literally need 24 more hours or another day, I'm not going to.
Well, yeah, we're not going to be pedantic.
Yeah, yeah.
Yeah. I mean, I'm not going to be,
If they just.
we're the state of New Hampshire, we're not jerks.
I think this is,
I
I'm
mean-
sure it's not actually, but, no, I think to your point, Council, guys, if by the 15th is, they've committed to closing, they can't follow through on the commitment, and there's no evidence that it's going to fall through in any way, then, yeah, obviously the state would have to move in a different direction.
We've agreed to the 15th, they've agreed to the 15th. We're moving forward without any issue meeting the 15th. The 15th is when it's going to happen. If for some reason it's the 14th, I don't want you to sue me. And for some reason it's the morning of the 16th, I don't want you to sue me. But the 15th is the date we've agreed to.
What if it's the morning of the 25th? I'm going to sue you then?
Yes, you could sue me then. I would not move it to the 25th without one heck of a good reason.
If I may.
I want to sell the property. I mean, let's be honest about this. Our goal here, everybody's goal on the council, everybody's goal in state government is to sell the property to the buyer at the price they agreed to, that we agreed to, that everybody agreed to. Period. We're going to get there. There has been no effort at any point in this process. If you asked me last December, was I going to sell the property in 9 months? I'd have said, I think so, yeah. And we didn't. Is that the end of the world? It is not. But the fact that a very complicated sale is going to take 13 months instead of 9, I don't have any shame.
No, sure. So I think the most important aspect between the last meeting and this is that we got the buyer to agree to a closing date.
Oh, absolutely. That's a huge accomplishment.
That's a huge accomplishment. And there was some angst, I think, on their part, because they know there's a lot of details to be done between now and then. But I think both sides have full confidence that can be.
Absolutely.
Okay. As long as I don't want to speak out of turn. Council Warren?
I know there were certain contingencies that allowed the buyer to get their deposit back if those contingencies were met. Have those now been met so that if they back out, they will not get their deposit back?
Like I said a few minutes ago, I think so, but let me talk to our lawyer and give you an answer to that question that's precisely accurate. Because I don't want to tell you no way, no how, because it'll be held over my head. I will tell you by email no later than tomorrow whether the answer to that is absolutely or there are some minor conditions under which they could back out.
And what is the amount of the deposit?
It's about, yeah, I think it's about 200 grand-ish.
But what that would be included in?
Yeah, I think it's about 200 grand.
How do we not know exactly what a deposit?
Counselor, I've talked to you about this before. I have lots of numbers in my head every day, and I don't commit all of them to memory, because I can look it up.
The size of that project, I would think you'd have that embedded.
No, I have bigger things embedded.
If you could put that into the email, that would be, for all the councilors, that would be very useful. Councilor Kennedy. Kennedy. Kennedy's now, I'm sorry. Councilor Kennedy.
Bob is my first name. So someone emailed me on some information. So the short story is that state granted extension until December 15th. The agreement on snowmobile trails and most other issues need DOT approval at this retreat regarding easements to drainage. Closing proposed February 17th. Is that the accurate date, the 17th?
No.
It's not, okay.
The 15th, I think is what I said.
You said, so, okay. So we'll just clarify.
So what we agreed to extend, the buyer and the seller agreed in writing to extend the title cure period through December 15th. And that's a formal thing that happens that lawyers insist on and is part of the purchase and sale. What we said in exchange for agreeing to that is we said to lawyers at the McLean Law Firm, whose names are Tom Hildreth and Laura Dodge, so if it's from one of them, that might convey that it's their understanding. If your email's from one of them, in which case I would need to reach out to them. We said that in exchange for that, I want to close on January 15th. They had originally proposed a later date, they agreed to an earlier date. And I said January 15th, so.
So when we do the signatures from both sides, who is representing the state, who's looking over the table?
2 weeks to, you mean at closing? I believe at closing, and I will confirm this, that I will sign on behalf of the state.
You got that, Council Gatsas, Commissioner will sign.
I will confirm that and email that to you as well tomorrow. Because,
Do you have
again,
any witnesses, you know, district?
my understanding is that most closings do in fact have witnesses.
I'll be honored to be a witness.
If you would like to come to the
I
closing.
would love to come to the closing.
Okay, is that okay?
I don't think there's anything legally wrong with witnessing the closing.
No, but I got to the council in 2014, we've been talking about it ever since, so I'd like to be.
I would
Show
love
up at the
it.
closing, and
I would love to have you
if the
there.
closing doesn't happen, you're gonna be blamed for not making the closing. I wouldn't want to be that. No, we'll get there, we can get answers to everybody in writing.
You have to drive yourself, though.
So I know this isn't an actual item, but just, I know we did commit to discussing it. If there's any more questions on this, just keep us posted if anything changes. Great.
You'll be the first to know.
So we do have a couple of items from administrative services. First, let's take up the late item, if you don't mind. We do have asked for a motion to adopt late agenda item A from Department of Administrative Services.
Second.
Any discussion? This is the Governor and Council calendar. Hearing none, all in favor signify by saying aye.
Aye.
Any opposed? Late item A is approved. We also have a tabled item. Can I get a motion to remove agenda item 157 from the Department of Administrative Services from the table?
Second.
All in favor of removing item 157 from the table, please signify by saying aye.
Aye.
Any opposed? Item 157 is removed from the table. Could I get a motion to adopt agenda item 157 from Administrative Services? Thank you. Second? Second, thank you. Any questions on item 157?
So I just want to thank the council for giving me a little time to look into this item. It turned out to be a complicated item. I learned quite a few things about the bidding process. I talked to some other contractors, and although they thought it was a little hard to quantify, they said, go for it.
Okay. Okay, great. Further questions? Okay, seeing none, all in favor of item 157 from Admin Services, please signify by saying aye.
Aye.
Any opposed? That item is now approved. We have one more item before us. Can I get a motion to adopt agenda item 111 from the Department of State?
Second.
Any discussion for the Department of State? Okay, hearing none, all in favor of item 111, please signify by saying aye. Aye. Any opposed? All right, with that, item 111 is approved. That concludes our agenda today. Piece of cake. Thank you, everybody. We will be back for our last meeting of the year on December 20th, right here in Council Chamber.